with our trauma series.
Yes.
Today we're talking about your little specialty, complex trauma.
Yes. You call it little, but it's big. It's big. It's big. Yes, that's my area of specialty.
Yes. So, tell us about it.
Well, where do we want?
Okay, let's start with, you've been in this field for a while.
Yes.
Mm-hmm.
Since before you were born.
Right. Tell us about your experience with complex trauma. What drew you to working with it? Mm-hmm.
You know, sometimes I don't know whether I drew myself to it or it drew me, what have you. I tend to be very faith-based and try to listen to where I'm, sort of being led. So I joke with some of my undergrad students to be open to their experiences because I joke that I got my psychology degree completely by accident. And I joke, but it is true. That was not my intention.
I do believe you've shared this before.
Yes.
She was an English major.
Pre-law English with a minor in history and secondary education. And I took my LSATs and I sat in on a couple of classes and I was like, wait, what? Contracts, tort, litigation? Like, poke my eye out. No. So, but yes.
She did one more psychology class.
One more. The registrar was like, Angel, you only need one more.
For a major.
And
then she went on to get her master's and then her PhD.
Right. But in true undergraduate student form, you know what my question was?
Who was the professor?
I did. I was like, who teaches that? So, but yes. So
not everyone gets to pick and choose with who their professor is.
No, it's just, it was what it was. But that tells you this should have told me something, right? Because anytime I had the opportunity to take an extra course, I typically either took a psychology course or a language course.
Yeah.
So I'm just very interested.
And now she's a teacher.
And
a professor.
Right, because I didn't want to end with school.
Right,
so this was the way to keep going.
Right.
And so, I think instead of going to what I had sort of planned to do, go to law school, I ended up moving to Chicago and getting a job working with inner city youth in a residential facility. So teenage girls. I learned so much from them. Yes.
Yeah. I'm sure you did.
It was. Well, and some of them I was not that much older than at that time too. So, but it's so full of life and I think that that's the thing that I love. And, when we think about complex trauma, that one of the things is almost all the clients I've ever worked with, there's just a resiliency and a sense of humor and just this, there's a lot of tough things have happened and you see that in some of the things, but they go about living their daily life just full of spunk and vinegar sometimes. I don't know if I said that right. I don't think
okay.
it doesn't. Okay. It sounds very wrong. I'm sorry. It's late.
They're all very spunky.
Yes.
They got personality and they let it show.
They do. So I want to be clear on what complex trauma is and is not, because I think there's a lot of confusion when we say the term complex trauma, because a lot of times people think, oh, it's just trauma that's complex, which, that can be true, but inherently all trauma is complex.
Yeah.
Yes. So no matter what the situation, there's always these different aspects of the individual and the culture and the type of trauma and the age and all the details that happen. So I think anytime somebody's experienced a traumatic situation in which they felt like their life or somebody else's life was in danger, then that is inherently complex. But that is very different than what I'm talking about with complex trauma.
So tell me what complex trauma is.
Yes. So we call it complex trauma or complex PTSD, although we have been working very diligently to get a new diagnosis in the DSM, which is called developmental trauma disorder. And what we're meaning by complex trauma is it's usually two things that are occurring with this. And it's typically during childhood, especially those early child caregiving years, that 0 to 5, 0 to 6 especially, that they've typically experienced abuse or neglect at the hands of a caregiver. So somebody who was supposed to be taking care of them, protecting them, was either unable to or they were actively harming them. And there could be a lot of reasons. So I don't want people to ascribe blame. Sometimes we've got, we'll think of sort of the traditional, the mom who may be having depression. So the mental illness of a parent, substance use, so there's lots of things that could be going on. Multiple children, and sometimes a special needs child takes a lot more than maybe the others. So there could be lots of things going on that whatever that was happening for that specific child, they may not have been able to get all that they needed in the forms of their caregiver. This can also happen in, daycare settings, and so forth. So that's the first part of it. The second part is that because of this, there is this subsequent development of impairments in functioning that create various sort of behavioral and psychiatric types of issues for them. And so what we know is that when a young child experiences abuse or neglect, this impacts a lot of different areas of their life. And it tends to impact them long into adulthood.
When you say it impacts different areas of their life.
Yes.
What are we talking about?
Yes.
How do we see it impact?
Yeah, and this is what makes it very distinct from PTSD, because post-traumatic stress disorder was originally designed as a diagnosis that captured what our combat veterans experienced. And so, and while many of our individuals who've experienced complex trauma, while they may meet the criteria of PTSD, many of them don't because of the multiple clusters that have to be met, the various criteria. And then also by nature, especially since one of them is avoidance, by nature, we typically don't let kids avoid, right? Because we have other names for that. If a kid is clinging to mommy's leg when they're 3, what's the name for that?
Clingy.
Yes. I love the non-psychological jargon.
The Velcro kids.
The Velcro kids. Oh my goodness. I love that you're not pathologizing it. Nope.
I'm over here minding my own business. They're
separation anxiety.
Yes.
Mm-hmm. And it could be separation anxiety, or it could be that they're wanting to avoid going into whatever situation. We really have a lot of names for our teenagers too. Right?
Oh, Lord.
If they don't want to go to school, what do we call that?
Lazy, truant, delinquent. Let's see. We got antisocial.
We got all sorts of things.
We got all sorts of things.
And it is very possible that those are just behavioral
They could
issues.
all just be true.
They could any of those be true.
But it could also be complex trauma and avoidance.
Well, or I want to ask more questions.
She's all about the questions.
Well, it's about being curious. I want to know what their experience is like. And so a lot of times if I have a kiddo who is avoiding school, then I want to know what it's like. What does it take for you to get up and walk into that school building? I have seen where some kids have to get up, they have to get their siblings ready, they have to get to a bus, they have multiple things only to be greeted. And I've seen this, only to be greeted at the door because their pants are too big and falling off of them and they need to pull their pants up. And the minute they walk in the door, it's a power struggle. And it's like, are you freaking kidding me? This kid, we know, went through what? I don't know that this kid is intentionally wearing baggy pants. This could be the only pants that they have on or that they have, and they don't have a belt. So why are we not welcoming them and saying, I'm so glad you're here?
Because there is that power struggle of some people are just intentionally showing their ass cracks.
And maybe, but I just, for the most part, and there are some kids that do, but for the most part, some of them just want to be seen and welcomed in, like, just scooped up and just, and I know we can't scoop up our 16-year-olds.
I don't know any teenager that wants to be scooped up, okay?
Probably not.
But mentally, maybe emotionally, they want to be scooped up. It's the emotional,
right? Because we can't do that with our adolescents, right? Like, there's boundaries. But there is something about welcoming them and just letting your eyes light up that you're glad to see them walk through those doors. So anyway, we don't let kids avoid typically. And so a lot of times that's why they're not meeting criteria for PTSD. And that's okay. Not the only reason why. So with developmental trauma disorder, right, because we know that when a child who experiences trauma, and this is why a trauma that happens in childhood oftentimes is more impactful than in adulthood.
Because they're still developing.
They're still developing, and not always, because there are some traumas that are just life-changing, life-altering, and so forth. But what we know, developing brain, right? This is my idea of a brain. But the brain develops from the brain stem to the front. And so this is the last that's developed, which is usually about what age?
25.
25, right? Who knew this before the researchers, or at least the psychological researchers? Oh, yeah.
I don't know.
Yep, it was car insurance. Right? Because there was just something magical.
They could just tell that at 25, there was just a complete 180 switch of something.
Your car insurance is always like, this has been decades. They knew this long before.
They knew that 25 years old and older
made better decisions.
Yes.
They drove better. The accident rates went down. So anyway, so we've known this.
The research was there. They were the original researchers.
I think so. And so anyway, the brain develops. And so therefore, if you have an infant at 6 months versus a 2-year-old, versus a 5-year-old, 10-year-old, 15, 20, like the impact to development and to that developing brain is really important, right? Because then anytime you're triggered, anytime you're feeling more stressed, less secure, a lot of times we regress back to the behaviors of when that trauma occurred. Mm-hmm. Until we learn or until we have the healing to resolve those trauma experiences. And so that's why early intervention is so important. And that's why we recognize some of the different signs that we might be seeing in regards to trauma reactions. So you asked, like, what do we see with especially developmental trauma disorder or complex trauma?
We talked about avoidance and we talked about the impact on the brain.
Okay, and so the avoidance is more about PTSD. So there's what we call domains of impact. The brain development is one of those. We call have that into the physical development. the number one thing we're usually going to see is, which is sort of a hallmark, is affect regulation, right? So that when they have that affect or emotion, they have difficulty regulating themselves. And so we'll see a lot of times the going from 0 to 60 in a hot second, right? The kid in the classroom, he gets upset and flips over the desk and sort of says, F you, and walks out. Or the kiddo who just puts their head down and they shut down. We see that a lot. So they have difficulty, starting, stopping. So I think in terms of affect regulation, I'm looking at softer, louder, faster, slower, that ability to be flexible and modulate themselves based on the situation and so forth. And so that affect regulation is sort of those internal emotional aspects. And that leads us to the second domain, which is behavior. And that's more the external things that we see. So we'll see the impulsivity, we'll see the aggression, whether verbal, physical, things like that. There's tons. I don't know why I'm suddenly going blank, because we see it all the time with that. So we've got affect regulation, we've got behavior, then we've got the physical, which is where we'll see the body and brain sort of connection with that. And so we talked about the brain development. We'll also see a lot of physical complaints is very common. So a lot of headaches, stomach aches, digestive issues, maybe some breathing problems, asthma types of stuff, heart racing, so the cardiopulmonary, heart racing, blood pressure. And so sometimes we'll see conversion disorders.
And a conversion disorder is what for our non-clinical people?
Do you know what the conversion disorders are?
If I knew what it was,
Yes, you would ask. So conversion disorders are those issues that they seem to be manifesting in a physical complaint, but there is no medical explanation for it. So we'll see just can't move your legs, right? And there's no medical reason why they can't. I've treated individuals with psychological seizures, right? Those pseudo seizures are pretty common. So those are conversion disorders. We see a lot of issues with maybe inability to feel pain with that. We have, when you think about some of the somatoforms, so like knowing where their body is in space and so forth. There was something else. One of the things I'm really delving into, because I've worked, over 20 years with children and adolescents and their families, and I've been working more recently in my practice with a lot of adult survivors. So really anywhere from those 18 to, 80 some years of age. And one of the things that I'm noticing more and more is the onset of autoimmune issues. There seems to be a pretty, I would say almost all of my complex trauma adult cases, if they're in their mid 30s or older, we see an onset of an autoimmune issue.
Interesting.
It is. So this is where I'm trying to delve into with some of my research practice. Mm-hmm.
Have you started?
Have I started? Well, there's not a lot of literature on it, although we are seeing more that fibromyalgia has usually the onset of a trauma as a catalyst. And so that seems to have some good research, but I have had clients with alopecia, rheumatoid arthritis, fibromyalgia. I'm trying to think. And there's some others, quite a few others in there that a lot of thyroid issues and so forth. So it is something that I want to delve into more with that, because this really speaks to, which we know we want earlier intervention as it is. But this really speaks to the need for more, because autoimmune issues, once you have them, then you're even more susceptible to having multiple, and stress tends to be one of the biggest triggers for flare-ups in autoimmune issues.
So you mentioned early intervention. What happens without treatment?
I think it's going to depend on the individual, right? I think everybody has different levels of functioning. And so you may have some individuals who have somehow managed, because, we have to think the complex trauma is sort of what happened to them and what their environment was like growing up. And this is the other key difference about complex trauma, which is for many individuals who've experienced a single episode trauma, right? It can be devastating, life-changing, but there is a clear before and after.
You don't get that with complex trauma.
You don't, because for almost anyone that I've ever worked with complex trauma, that's just life. That's just how it was growing up.
That's a regular Tuesday for them.
Yes. And so that's what makes it sometimes sort of challenging, is many times they don't even recognize their experiences as trauma. And so what happens then, and we've talked about half of the domains, there's still more, but then what they do is a lot of times there's such an internalization of, this poor self-concept, how they see themselves of like, I'm bad, and you'll hear this a lot, like, I'm a bad kid, nobody likes me, they feel like they're broken and they can't be fixed and things like that. And so they internalize that a lot instead of seeing that, well, okay, based on your experiences, that's a pretty common trauma reaction. And they've never thought of this in terms of that. And so that gives them, oftentimes through treatment, what we want to do is help them understand, well, where we're normalizing some of their reactions, right? Not ever saying that their behaviors are okay if they're not. So we'll never condone behaviors, especially that are putting somebody else at risk, harming others.
But you're making them feel less isolated, less alone.
Right. Like if they haul off and hit somebody, right? Like, and they're,
that's not
I'm
okay.
always doing. It's not okay, but I get it.
Yes.
Right? Like based on your experiences, wanting to haul off and hit somebody is a common reaction. Mm-hmm. And they're like, wait, what? And I'm like, yeah, it's not okay to haul off and hit somebody, but based on your experiences, that tends to be common. That's what you learned. And so what we then do, or at least the way I do things is, and where a lot of the self-loathing comes in, right? Because they're usually hating themselves for being the way they are. So what we do, what we do is we'll do a lot of values exploration, right? Because a lot of the self-loathing is because you tend to be very protective of other people. And that is not aligned with hauling off and hitting this other person, whether you think they, you were happy with them or not. And so a lot of times they're behaving in ways that go against. Yes.
What they believe.
It's sort of like the best way to think about this is for those of us who, just to think of a common one, when we have a health goal, right? Many of us have had a health goal because health is important to us. And so when we are making decisions that are aligned with our health goals, we feel
proud of ourselves,
powerful, in control. But when we're making decisions, especially consistently, that actually are against, we may not realize it, but that's where we get onto ourselves or, and that self-loathing and this and that. And so that's part of the work that we tend to do. So going back to some of the domains, and then we'll come back to the treatment. I know, what, were you going somewhere?
No, I'm so glad you're answering my questions.
I know there's so many.
She answers it in a very roundabout way.
Okay, because this was actually...
I asked about treatment. She went to self-concept. Which I had a question about self-concept, but here we are.
Here we are, and we'll go back around. But this is exactly what treatment is like with complex trauma. And
you can't predict it.
Well, you can't predict it. I mean, to some extent I can.
But everything's all intertwined also.
It is. And so I tell my clients it's usually like pulling back the layers of an onion. We can start with one thing and we get so far, but then we have to start on another because we can't go any further until we pull this one back. And you're doing multiple things and just touching on all these different domains because they're all so connected. So do you remember so far what we've talked about? Affect regulation.
Behavior, self-concept,
right? And then the body.
Brain, the body.
And then cognition is another big one. So the way that they think and learn. And so the ability to have memory, the way that they process information, especially new things, they have a very low frustration tolerance typically. So we see that especially in learning where they're oftentimes not feeling very successful in the academic setting or at the work setting sometimes. And so, and this is, and because cognition also deals with attention, this is why oftentimes we'll see ADHD symptoms somewhat similarly in individuals with complex trauma. And that's sort of tricky, right? Because you've got to be looking like, is this inattentiveness a trauma reaction?
Or is this ADHD?
Or is this ADHD?
Or is it both?
Or is it both? But you want to be careful because and this is why accurate diagnosis is so important, especially with kids. I think with adults too, but especially with kids, because when they are misdiagnosed, and sometimes that's overdiagnosis, underdiagnosis, then that can impact treatment, right? Because for me, the reason why I want an accurate diagnosis is because that tells me which type of treatment might be the best approach for them. Because when I'm dealing with this diagnosis versus this diagnosis, or wow, this one is comorbid and it has these things, that informs the type of treatment that I typically am going to be recommending for the client. But I'll include them in it and let them know what I think so that way they can sort of, it's important, especially trauma survivors, to have a say in their treatment. And so I'm usually trying to give them as many choices as possible with that. So, all right, we haven't gotten all the domains yet. I know we keep going around. Sorry. So affect regulation and behavior, the
physical, cognition,
dissociation. That is a huge hallmark of complex trauma. You know, you want to talk about dissociation a little bit?
Go for it. Do I want to talk about it?
Sure.
Well, I feel like we sort of started hitting on it when we were talking about, some kids go 0 to 60 and then some kids just put their heads down and disengage. Mm-hmm. Yes. So the putting the head down and disengage, that's not quite disassociation.
It's not. It depends. I might check on it though. Go ahead.
No, keep cutting me off. I love it.
Sorry. Get so excited.
Go for it. Just talk about dissociation.
Y'all, I was going to say, we're okay, right? I was going to say, we are not okay over here playing in this summit. We've been got lots of going on into the school year. So many things happening.
10 p.m.
Oh, so.
Anyways. No, you talk about dissociation because I don't know what it is apparently.
Well, the shutting down can be, but I'm going to see that oftentimes more as affect regulation and the behavior.
I wasn't saying that the shutting down was dissociation.
No, I know you weren't. So dissociation it can vary from, it's usually an altered state of consciousness where we're starting. So there can be some depersonalization, derealization types of things.
I have a question. What's the difference between disassociation and zoning out?
So zoning out is a very specific behavior, right? You're there, you're zoning out. This happens when people are overly stressed. So it's something we want to watch for to see if it has some elements of dissociation to it. I think of dissociation as a continuum. So on one end, we might have some zoning out when they're stressed, like when they're overwhelmed, they just tend to zone out. That could be a normal stress response because they're overwhelmed, or it could have some dissociative aspects. So we've got to take a look and see. I want to know a little bit more with that. Whereas dissociation has this whole long continuum where on the other end, we actually have the dissociative identity disorder, right? People can black out, take on the altered states of different fragmented personalities and so forth. So, and there's a lot in between. So the depersonalization will sometimes ask questions. The big questions I usually ask just to get a sense, because I don't want to do a full blown assessment for dissociation if there's no indication that I need to check into it more, at least right away. But I'll usually ask a question, so do you ever feel so stressed, and zone out, or, and then another one is, have you ever had moments where you feel like you're sort of outside your body, like you're watching, like you can see yourself doing and seeing things, but you're not there. And so usually either the response, especially with kids, they'll either look at me like, no, I'm not crazy, dude. Like, okay, so they don't have that. Or it tends to like, really? Do other people have those? And so it normalizes because sometimes they haven't really understood that could be a common reaction to what they're experiencing. And I do see dissociation tends to happen certainly more so with complex trauma than PTSD by itself. And I tend, at least my experience has been, I tend to see it more with individuals who've experienced sexual abuse as a child. And so, when you think about it, dissociation at that time served a purpose, which was to survive. And so a lot of times mentally they went somewhere else. And so that served them well during that time. But what happens is when they are no longer in those situations and instead are in safe situations, but they are still using dissociation, it does cause a lot of problems, especially in relationships, right? You can just be sitting there talking with your friends and suddenly you're zoned out and they're like, hey, hello. And so friends and partners tend to feel like they're just not there present. Yeah. So that's dissociation. And then we get into what I call the 3 attachment domains, right? So if we think of John Bowlby's work with attachment theory and the internal working model, right? Which is, and you remember baby A, baby B.
I do.
Yes.
I do.
Do you want to show
want me
us?
I'm not going to show you. I'm not fun like that.
Oh.
I don't enjoy embarrassing myself like you do.
I bet you could be fun like that.
Baby A. Would you like to demonstrate?
No, I want you to demonstrate.
Not going to happen. It's basically how a person would normally interact with a baby. Like, oh, you're so cute. Making faces. That fun little voice. And then baby B. It's sitting in his crib crying.
Right.
Yes. Being ignored. Both the same age, both babies, very different experiences.
Very different experiences. And so baby A, right, when we think about how they're experiencing the world.
Everything's fantastic. Everything's great. Everything's rainbows and sunshines and unicorns.
I don't know about sunshines and unicorns, like everything. But
they have everybody's attention. All eyes are on them.
Yeah. And so they begin to see, like, I'm the bomb. Like, I matter, I'm loved, I'm cared for. And then they see others that way. Like, I can trust other people. I can rely on them. Other people are good. And then they see the world as safe.
Yes.
Like, this is an okay place to be. Right? versus baby B.
It's doom and gloom. They're hungry. They're not being fed. They're crying. Nobody's coming.
Right. And again, we typically don't, I try not to ascribe any blame to that because we don't know. I mean, parent could be working 3 jobs, trying to make ends meet. There could be multiple kids in the home. Like I said, they may be dealing with their own stuff. And that's something that we have to keep in mind is complex trauma also typically happens within other adverse situations such as systemic racism, oppression, historical trauma or ancestral trauma, intergenerational trauma, poverty, and those types of things. And so because of these cycles types of things, oftentimes, many times parents are doing the best they can with the skills and resources that they have available to them. I would say typically every once in a while I see some situations it's like, no, that was just downright, abusive. And so there are obviously those types of situations, obviously, some of the extreme physical abuse, torture, things like that. I'm not talking about the parent who is overwhelmed and frustrated and ends up, backhanding a kid. Not saying that is okay. It's not. But there's a different level of intentionality from some of the, really some of the cases that I've seen where it's like that takes a certain level of
push until your breaking point.
Yeah, I mean, there's just some things I've worked with that are just heartbreaking, thinking that another person could do that to another human being, let alone a child, an infant. It's there's a lot of sick people. But for the most part, I believe that many people are doing the best that they can. So yes, so the self-concept, how they see themselves, and then the relationships with others, how they view others.
Baby B sees himself as unworthy. Nobody wants them. They're not good enough. Mm-hmm. They don't deem the world as safe.
And they can't trust other people.
No.
So, and remember, these are the bulk of their experiences. That doesn't mean baby A never went without somebody changing their diaper or feeding them, or baby B never had anyone. It's just the overall experiences that's how they viewed the world. Mostly okay.
They've had mostly good experiences. They've had mostly negative experiences.
Right. So those are things that we think of. So those are the typical domains. Now, when we look at how the world, so we see this a couple of different ways. Their ability, their future orientation, to believe that there is a future, there's hope and possibility, and that they have the ability to impact some of that. That this is a just world, or that there's fairness and caring and so forth, versus, sometimes what I see is, why bother going to school? Education has never done anything for anyone in my family. And,
generational cycle.
Those are some generational cycles and how they believe. And, some of those things may have some validity. So we have to keep in mind that it's not that the thinking is right. It's just these are what their beliefs are. Another very common one, especially if you have, if a child has grown up where there are multiple adults who have cycled through the home, meaning the parent has been involved in a lot of relationships. So just, for sort of a cliche sake, we'll say that the kid is with mom, and if mom has multiple boyfriends over the years, then they can sometimes grow up believing that men don't stay. They come and go. And so that becomes the way that they see the world in that sense. And so those are just things that we have to keep in mind as we're considering what might be most helpful and what they want to believe about themselves. Because a lot of the healing that has to happen is, what is it that they want to believe about themselves and their future? What is it that they want for their future? Mm-hmm. And really that's my role as a clinician, which is to help them sort of write that story for themselves. So yeah, the domains of complex trauma. I think I got through them all finally.
Can I get back to my questions?
You can.
Okay.
You can. Okay. I answered one. Yay, I got through it.
I don't remember asking you about the domains, but cool.
You did. You asked about the impact. And I said it's about the domains. Yes. I had to get them all in there.
Okay. Do you want to try and answer my question about treatment again, or do we want to move on from that because you answered it the best you could?
No, we can talk about treatment all night. Let's do this. What questions did you have?
Well, I did ask you, what does treatment look like? And you did say it varies, obviously.
It does.
Because everybody's different.
So I can tell you what I will typically do.
Okay.
Because it's complex trauma, a lot of times there's not this one trauma that they need to process. So there's two ways you can treat trauma, right? One is to process the traumatic event. And there's lots of different interventions that we can use. We can do trauma narratives. We can do EMDR, cognitive restructuring. So there's lots of really good, effective techniques for that. That's one way. The second way, and this is how I typically, especially in the beginning, like to do treatment with my individuals who've experienced complex trauma. And that is helping them understand how their past experiences are impacting them today. Because I usually am like, what is causing you the most problems right now? So it's going to vary depending on, a lot of times we'll see the age, so it could be relationship issues because there's a lot of relationship issues. So that could be it. For my individual who might be experiencing significant health issues, that could be causing the problem. If I've got somebody who is experiencing severe panic attacks and ending up in the emergency room a couple times a week, we're going to start there because I'm like, really, we want to not have you.
What is the biggest issue right now?
That's it. I want to know what that is. And so we're going to work on that. And then I'm also usually asking about sleep because I want to get that sleep dialed in.
Sleep, eat, move.
Yes.
I think we've said it in the past 3 trauma episodes.
We do.
Yes.
Yeah, because you cannot eat like crap all the time and think you're going to feel better. But sleep is going to be my first session and what is causing you those problems, because I think also most people who, when we're getting to the root of things, especially session 1, don't get me wrong, I'm asking a lot of questions because I'm doing this from a trauma-informed way. And so there's lots of things we're going to get to, lots of things I ask people up front. But those are the 2 things I'm usually going to start with. And then we get into some of the food and movement and stuff, usually within a couple of weeks. But if I've got somebody who's having panic attacks, I mean, that's scary. They think they are dying and having a heart, and so they're going to the emergency room. That is an awful feeling. And so we want to try to get that lowered right away so that we can get it down to where they don't at least have to be going to the emergency room, that they have the skills and resources to recognize what's happening and that they feel that there's some things that they can do. So it really just depends on what is happening in that person's life.
Okay. We've touched briefly on relationships, but what you gotta say?
What do I have to say?
How does complex trauma impact relationships?
How does it not? Because think about this. If you're learning, especially from a young age, that people who were supposed to be taking care of you either didn't, couldn't, wouldn't, whatever it is, right? And many of my survivors of complex trauma, like, they get that their parents were doing the best they could. Like, they get they were dealing with their own issues. And it doesn't change the fact that they did not get what they needed.
Those were still their experiences. Very valid. And they're doing the brave work
because they don't want that cycle to continue. And so that's the thing that inspires me a lot of times when I get to work with clients, is just seeing how hard they work because they want to just sort of be normal, right? And, whatever that word means. And that's what this is like, whatever that means. Yeah, because you're never going to know because you've never had that for yourself. But
and what is normal exactly? Let's be honest here.
Yes, there's so much. That should be a whole episode by itself. So we won't go there. But I think that that's one of the things, is it's showing up all the time in relationships. It's going to show up in the way you relate to your friends, right? How much you can be present. What boundaries do we set up? And that's not one of my favorite words, but I don't know that there's a much better word, meaning you show up for the people that matter to you, and yet it's okay that you are able to engage in reciprocal. Like, I'll do things for you and I expect things in return. And when you start noticing that, you know what, I'm always the giver and they're never there for me, then you start to question what's happening. So the ability to engage in reciprocal relationships is oftentimes skewed. Either we see overly assertive and sometimes even a bit abusive in the way that they might relate to others, verbally abusive and so forth, or sort of that doormat, for lack of a better term. I'm using what my teenage girls used to teach me, that to being a doormat type of thing, and letting people walk all over them. And so, and I think that balance is really hard for most everyone. Like, what's the right? Because we give other people grace and we try to be there. And I never think things are 50-50, right? If it's a relationship,
there will be times that one person can give more than the other.
Always. I mean, sometimes it's 80-20, sometimes it's 40-60, but how are people showing up? And how do we know that you've got your backs? And different relationships are different. And it's okay. Friendships, you might have a friend who you like to do this thing with and a friend you like to do that. And so that's okay too. But it definitely shows up in, you think about any type of authority relationships, because why should they listen to somebody in authority? Because it's not like they know anything. They've had to survive and sort of take care of themselves. And whether that's true or not, that's oftentimes the perception, right? And so they just don't trust that other people are going to lead them in the right way. And so we'll see that. We'll see it in work relationships too. So it definitely shows up in relationships all the time. I guarantee you. I mean, we say this. It's very common in couples counseling. You know what I'm going to say, right?
I think so. Go for it.
So we'll start couples counseling, and it's not unusual within about 3 months that we pause because one of them has an unresolved childhood trauma, that when we pull back the layers, that one of them realizes they may have some more work that they need to do individually before we can really do much more with as a couple. So very common with that.
What is one thing that you wish the average adult knew about kids with complex trauma?
Kids with complex trauma that I wish the adults knew. Well, I don't think that all adults at all times needs to be the all-encompassing supportive adult. I mean, as much as I
take care of yourself too.
You do. I mean, like for me, I want to go to an adult all-inclusive for vacation because sometimes I just need a moment to not. Mm-hmm. But I think for the most part, what I would want adults to know is the power that they have in just being kind. It doesn't take much to look at kids and just smile.
And yet it's so hard for so many.
It is. But I mean, I think that that's the work that we have to do on ourselves. I know that I'm not always that person. I try to be, but not always, because I might have things going on, or I'm tired, or I'm just oblivious, right? But sometimes I'm just tired and crabby. She does. But for the most part, I hope that when, especially when a kid locks eyes with you, I hope that they can see
She's
the
smiling
joy.
at every single one of them.
I do. I hope that they can just see the joy, and I don't know. There's just something, if you can transmit that this awe and specialness, like, why wouldn't we want to?
Okay.
I know. You think I'm sort of cracked sometimes with that. That's probably not the best.
Anyway.
Why did I just have an image of Humpty Dumpty on the wall? I don't know.
Okay.
Now we're reading nursery rhymes. That's not the one I would usually read to children, though. I like fun, uplifting.
Yeah.
Yes.
Not one where they couldn't put Humpty back together again.
No. Because we got to put Humpty together. That's just not okay. We can't leave it like that. Mm-hmm. Yes.
Our episode was structured for a little too long, guys. This is where it devolves.
No. There was something else that you had said earlier, and it made me think of something that I really wanted to say, and I can't remember. Oh, treatment. The one thing I will say that is sort of non-negotiable that I use in treatment, because again, if somebody is experiencing panic attacks, if I'm needing them, well, if we want them to really see what's happening with their sleep cycles and some of these other things, mindfulness. And the mindfulness that is trauma responsive in a way that they are being intentional and purposeful and completely in charge of what they are doing and how they're doing it.
And not just doing it because the therapist is telling them to.
Right. No, there's just no following along. Like, I'll model and I'll show them, but I want them to do it in a very specific way, multiple times a day. I don't care about, like, that 10, 15 minutes of mindfulness, like, ain't nobody got time for that.
30 seconds, 3 minutes at most.
Yes. I mean, don't get me wrong. This summer, I'm going to increase. Like, 3 minutes is my minimum in the morning. But I do several throughout the day that are very brief. And that's what I'm usually wanting my clients to do, is much more brief throughout the day. Sort of those resets and checking in with themselves. Because, right, affect regulation. It starts there. And if you do not know what your internal states are at any given time, because they can change, then that's one of the first things we have to do, is recognize what's happening within yourself, outside yourself, and so forth.
Mm-hmm. I have one last question for you.
Oh?
What keeps you hopeful when the work gets heavy?
Y'all, the work can be very heavy sometimes. There are just some things that are heartbreaking. The thing that keeps me hopeful, it's just that the clients, man, the survivor in them, the whatever it is, and everybody has different strengths, right? Like, and that's the thing that I love, like, because one of the things I'm doing is I'm asking what happened to you, right? Because to be trauma informed, I need to get their trauma experiences. And I'm also asking, holy cow, what kept you going through all of this, right? And so there's usually, for each one of them, there's something that keeps them going. And that's what I love, right? The resilience of the human spirit, and so much of it, the beauty. So there's just this way that people have, like, they want to be this help to others. Almost all of my clients, I mean, they just want to help other people. They want to, and it's usually like their family or their friends or, you know, their educators or helpers in some way. And they just have so much to give back. And so that's what I love seeing is whatever it is within themselves that keeps them going, that right there makes it all worth it.
Okay.
Yes.
Takeaways?
Oh. Well, right now I'm thinking, how is it that something this heavy and this devastating can, you know, we're talking about this late at night after we've been planning this long conference that's about to kick off, and this still excites me, thinking about these individuals who've gone through these rough experiences and they show up, they do the work on themselves, they want something different for themselves. So the takeaway, I think, is just this reaffirmation that I'm doing what I love, that I get to be this person who's on this journey with individual clients, and all the providers, because I usually get to work with thousands of providers each year who are out there doing the work, and I just love it. Now, I say that, and I will be very, very happy if I never have to work again, because there is no trauma.
She likes to say she wants to work herself out of a job.
I do. So I will be very happy, and I will find something else. I
don't think you're going to get that anytime soon, sweetheart, but one could hope.
I'm going to hope. I'm still going to be hopeful. Mm-hmm. Right? We're going to keep addressing this intergenerational thing, and we're going to keep getting better every generation. Yes. What are your takeaways?
Trauma's complex. Complex trauma is even more complex.
Yes.
Yeah. You are a little too giddy, happy over the idea of complex trauma.
I think right now there could be some delirium involved. I don't know.
It's astonishing that you are so passionate about this topic.
I am, very much so.
Yeah, those are my takeaways.
All right.
Bye.